You're watching Morning Live. Thanks for being with us. Now, even though South Africa is currently at level 1 of our coronavirus lockdown, if one looks around you, you could almost be excused for thinking that these are normal times and that COVID-19 is gone. And that's because many people are simply not taking the appropriate protection measures anymore. Now, on Saturday, 1,575 new infections were recorded in just a 24-hour period, making it very clear that South Africa is still in a COVID-19 pandemic. And joining us now to discuss this and to give us an update on other COVID-19 related issues is the Health Minister, Dr. Zweli Mkhize. Dr. Mkhize, good to have you and welcome to Morning Live once more.
Morning, Sakina, and all the other viewers.
Minister Mkhize, why do you believe that we are seeing some people simply not adhering to our own and, of course, other people's health safety precautions and seeing the numbers going up as we do?
Well, I think firstly, we went into a surge where the impact of COVID-19 was visible at a personal level. People were seeing friends, relatives, close people, getting sick and getting admitted, and some losing their lives. So they saw it very, at very close quarters. Then we were over the surge, and then that suddenly created the impression that the infection is gone, when in fact it hasn't completely gone. We are over the surge, and the numbers now, as we see them, we are seeing about 2,000 every day and about 10,000 in a week. And that number is indicating that the infection is still with us. And we've seen in the past week, there's been a slight increase, about 19% increase. Although if you look at the 2 weeks, we're still much lower than where we were 2 weeks ago, which is an important indicator of whether the infection is going up or not. So we can say, for example, we've kept a low-level plateau, which means the numbers aren't going far up quickly and are not completely disappearing. So they're still maintained at a level which is still significant. So people must know that we are not over the woods yet. We're still having COVID-19 with us. The concern really is that it can turn either way, and that's the point that our people need to understand.
Dr. Mkhize, are you concerned about the public's attitude towards the virus, especially since we've moved to lockdown level 1?
I am actually concerned that people need to take the issue of masks seriously. In some areas, people have they think that we said level 1. So you got people out there having lots of parties and drinking in taverns and out there in restaurants. People behaving as though this is a normal situation, forgetting the mask and forgetting the distancing. All of that is a matter of concern to us, and we'd like to send a message that we're not at a point where we can let go of all those containment measures. We need to continue with them because that's the only way we can actually reduce the chance of the infection recurring to a high level to what we had seen around July, August and such. So we are concerned. We'd like to send a message to say we need people to continue to observe those containment measures, use of mask, cough etiquette, cleaning hands, washing hands when using sanitizers, and distancing. Those are going to go on for a long time, long after we've gone past the surge, because we still have the threat of the infection coming for the second wave.
But how then do we go about as a nation getting the message across that, believe it or not, people, we are still in and going through a pandemic, Minister?
Yes, I think that it's important to say this is a message which must not just come from government. It must come from all the leaders, from media, from churches, from traditional leaders, from all the people of influence to say there is still a risk. We must keep to the containment measures because in some instances, it's young people that need to be made aware that you might have fun, but please keep it within the rules so that we don't spread the infection much higher. And so the message must go on from everybody to that kind of extent. At this moment, we are seeing other countries that had actually reduced the numbers already going up. Now, some 2 months ago, we were number 5 in terms of the total global total number of positive cases. we've been relegated to number 11. Now, we're still increasing, but it means other countries are increasing faster than us. The reason why they're increasing faster than us is because after they had a short lull, their numbers have now shown a second wave has come to them, which means if it could come to them, it can come to us. We've seen in the US, the numbers have gone up much more than what it was before. We've seen in the UK, they've started putting up curfews and restriction in restaurants and so on. In Spain, they've started putting up lockdown, and a number of countries have seen this. And so we haven't come to that point yet, but it's not possible for us to predict that we'll be different than the rest of the other countries in the world. So we must expect that the same thing can happen to us unless we ensure that our containment measures are kept in place.
And speaking to that and the likelihood of a second wave of COVID-19, as you actually pointed out what has happened in other countries, what would the prognosis be for South Africa in this instance? And is it likely to happen now at a later stage? What is your modeling telling you? What are your projections telling you, Dr. Mkhize?
We don't have something that's very concrete at this point. The models did get some of the things right and some of the things wrong. For example, the model said that we're going to have a surge around July, August, September. We got it from around June, July, August. And then they said we will get the surge around the same time, but at lower numbers. They were correct there. Our numbers were much less than the initial prediction that they gave us. And after that, we don't have another indication as to when the next surge is coming. One of the things that we're looking at is new work that's been done, which has been trying to compare when people are coming to hospital for other reasons to check how much exposure they have had to COVID-19. We've seen that in some of the batches of specimen, it showed about 37 to 40% in Cape Town. We then seen in the Gauteng area about 29 to 30% of people that come to the hospital, which was showing that there's a little bit more immunity on the community, but it is not sufficient for us to postulate as to what the immunity is across the whole nation. Is even if though that immunity was there, let's say up to 40% in that specimen, it doesn't mean that in the community we'll find the same thing. What it does mean is that there are more people who've been exposed to the infection than those that were reported to be positive. But the numbers that don't have the immunity, even in that case, is still too high to pose a risk for us. So we have to keep watching because we don't have the vaccine yet. Now, the vaccines are still under trial, and the earliest prediction is that some, if they are successful, some could be ready from around the end of the year. But whether we can have that as amongst the first people to receive it or not is another question. But even if we did, the cost is high, so it's going to take us a while to get around the issue of the vaccine. So the major issue for us is to say we're going to have to use containment measures over a period. But as to how many people could be already having immunity, we think it's not a very high number, even though those numbers might be a bit higher than those that we've been reporting as being positive, having tested positive.
So is there not another way in which one could test for that specifically, Minister? And also just in terms of testing generally, how are we faring in that regard as we speak?
There's a consortium which is led by HSRC and a number of academic institutions and government departments and provincial departments that is going throughout the whole country, doing a survey to check what could be the level of immunity across South Africans. That probably is going to take us another month, about 2 months or so to find out. And so when that happens, it will give us a sense as to what extent the infection would have gone across our communities, especially because we have a higher population of younger people whose exposure to the infection need not show in terms of severe symptoms and illnesses. So a number of people would have had a flu, would have had no symptoms, would have had mild symptoms, and therefore they may not have actually even been tested, they may not even have been admitted. So we would need to get a sense of that, which we will do in another maybe 2 to 3 months' time, and once that is done, we'll have a sense. But that's really just for background information. We still have to actively develop immunity in our community using the using the vaccinations. So that is when we will say we're a bit safe from an infection. Of course, that is assuming that COVID-19, the virus, does not mutate. If it changes, then of course the whole world is in trouble again, but that's not on the cards yet. So we are saying that the vaccines are offering a very promising prospects of protection, but they are not finalized at this point. So we just have to keep to containment measures and just remember that whatever happened in South Africa, so that we didn't get as much of the mortality that was said to be the possibility, and the numbers didn't go as necessarily as high as what we could have feared, but we are not out of the woods, and therefore the risk of return of the infection is still something that we can't exclude. But at this point, we can't say what saved us and what will cause it to come back. And so no one can say the risk is low, the risk is gone. We just are saying that we've seen that there's a bit more of immunity and we've had a limited conduct of the infection. So we can only hope that that will be the same situation even if the second wave were to come. And that is really a hope, but it's not because there's something that would have done to prevent the second wave from coming back.
Dr. Mkhize, we are, of course, now welcoming international travelers into South Africa again. Does this mean that we will be planning to roll out more tests nationally once more?
Yes, certainly. We are going to have to roll out more tests nationally. At the moment, the reason why you've seen the numbers of tests have decreased a little bit, it is really more because we put up a criteria that would actually net people who had come to various areas for presenting themselves. And that number simply shrank down. And I phoned a number of professors and said, but your test numbers are decreasing. They said, yes, it's because our patients' numbers have decreased. That means fewer people have been infected. Now, that's the reality we are facing. Fewer numbers of people are infected. Fewer people are getting admitted in hospital. Even though the numbers of death are still there, they are much lower than what once was the situation. So that's a very hopeful situation that we are in. But going forward, we want to increase the numbers of tests as well, because part of our preparation for the next wave is to have a surveillance mechanism, which at every district we must be able to pick up the variations in terms of the numbers of people who are getting positive, so we can easily pick up cluster infections. And when you do, we've got a scale now that we have put up. It's if you look at the week, you look at is there a 10% decrease on the previous week? If there is, that means basically we are actually going down in that area. We're stabilizing. If there is a slight increase and it's 10%, we then have to watch. If it's already 10 to 20%, it means we're now starting to have an increase. So that surveillance is in place now. We're assisted by the surge team from the WHO, and all of that plan is now what we're going to be working on so that we don't get surprised. We will warn the community, we will warn the public long earlier when we think that there's a slight surge that's coming in an area. We will also warn if we think that there's going to be a need for any steps that need to be taken. So people mustn't think that we'll wake up one day, there's a lockdown level 5. No, it won't work like that. We'll have to warn people to say, look, with this what we're seeing, and so on. Right now, what we're saying is that the numbers have come down, but they've not come to zero. There are still new infections, 10,000 a week. That's serious enough for us to take precautions.
Minister, we're going to have to leave it there for now. Thanks so much for your time. As always, Health Minister Dr. Zweli Mkhize speaking to us about the latest around the COVID-19 statistics and, of course, some of the measures planned by the department to make sure that if indeed there is a second wave, that we would be ready to deal with that. And that means that we at that point where we have to say goodbye to our viewers on SABC